Hello, my name is Pam, and welcome to my channel. Today, I'm excited to share some of the most important medical terms you'll encounter in healthcare, especially if you're interested in working at the VA as a medical support assistant. Think of this as your beginner's guide. These words are the building blocks of clear communication between doctors, nurses, and our veterans. Getting comfortable with them is the first step toward providing excellent support and service. So, grab a notebook, get comfortable, and let's dive into the language of healthcare together. By the end of this video, you'll have a solid foundation that will help you feel much more confident in a clinical setting. Let's start with the absolute basics, the words you'll hear and use every single day. First up is appointment. An appointment is simply a scheduled meeting with a doctor, nurse, or another healthcare provider. You might say something like, "Your appointment is on Monday at 10 a.m. It's the core of what you'll be scheduling. Next is follow-up. A follow-up is a later visit to check on a patient's progress after an initial appointment or treatment. It's crucial for continuity of care. For example, a doctor might tell a patient the doctor asked you to schedule a follow-up in 2 weeks. This ensures the treatment is working as expected. Then we have consult or referral. These terms are often used interchangeably. This is when a patient is sent to see a specialist for a specific issue. For instance, a primary care doctor might say, "Your doctor placed a consult for cardiology." This means the patient needs to see a heart specialist. Let's talk about prescription. A prescription is an order for medicine written by a doctor. As a support assistant, you'll handle tasks related to this. A common phrase you'll hear is, "I'll send your prescription to the pharmacy." This is a critical link between the doctor's order and the patient receiving their medication. Now for diagnosis. A diagnosis is the official name of an illness or condition that a doctor identifies after examining a patient. For example, a doctor might determine the diagnosis is high blood pressure. This is the starting point for any treatment plan. And that brings us to treatment. Treatment is the care, medicine, or therapy provided to help a condition. It's the plan of action. For instance, your treatment includes physical therapy and medication. It can be simple or complex, but it's always aimed at improving the patient's health. What about where this care happens? That's a clinic. A clinic is a specific department or area within a hospital or healthcare facility where patients receive care. You'll often direct patients by saying something like, "You have an appointment in the eye clinic." Let's discuss the types of care. Primary care refers to the main doctor or provider who manages a patient's overall health. They are the first point of contact. You'll often hear your primary care provider is Dr. Lee. On the other hand, specialty care involves doctors who focus on specific conditions or parts of the body. When a patient needs a specialist, you might say you have a referral to the dermatology clinic for your skin condition. Finally, in this section, we have triage. Triage is the process of assessing a patient's condition to determine the urgency of their care. This is especially important over the phone or at check-in. A nurse might say, "The nurse will triage your call to understand your symptoms. Great job so far." Now that we've covered some basic terms, let's connect them to the human body. Understanding the root words for different body systems will help you understand more complex terms instantly. First, let's look at cardio, which relates to the heart and blood vessels. When you hear cardio, think heart. That's why a heart specialist is called a cardiologist, and their department is cardiology. It's the study and care of the heart. Next is neuro, which pertains to the brain, spinal cord, and nerves. So, if a patient has a nerve issue, they might be referred to neurology, the department for brain and nerve specialists. See the pattern? Let's move to the framework of our bodies, the bones. The term for that is ortho. This refers to bones, joints, and muscles. A bone doctor is an orthopedist, and the clinic is orthopedics. So if someone breaks an arm, they're heading to orthopedics. What about our digestive system? The term for that is gastro, which relates to the stomach and intestines. If a patient has stomach pain, they might see a specialist in gastroenterology. It's all about the digestive tract. Now for breathing. Pulmo is the term related to the lungs and breathing. A lung specialist is a pulmonologist, and their field is pulmonology. Conditions like asthma or pneumonia fall under this specialty. And finally, our body's largest organ, the skin. The term for skin is derm. That's why a skin doctor is called a dermatologist, and their clinic is dermatology. Rashes, moles, and other skin issues are handled here. Learning these root words is like having a secret decoder ring for medical language. Cardio means heart, neuro means nerves, ortho means bones, gastro means stomach, pulmo means lungs, and derm means skin. It makes everything so much clearer. Let's cover some administrative and office terms that you, as a medical support assistant, will use constantly. These are the words that keep the clinic running smoothly. First is check-in. This is the process when a patient arrives for their appointment and registers at the front desk. It's usually the very first interaction. You'll be the one saying, "Please check in at the front desk." Next, we have chart or record. This refers to the patient's complete medical file, which contains their history, diagnoses, treatments, and notes from doctors. A key part of your job will be to update your chart with new information. You'll do this using the system. The system is the computer program used for scheduling appointments, accessing patient records, and managing clinic operations. At the VA, you'll hear, "We use the VA system for scheduling." Becoming proficient with this system is essential. Another crucial term is insurance or eligibility. This refers to the information about a patient's benefits and coverage for healthcare services. A common task is verifying this information. You might say to a patient, "Let's verify your insurance information to ensure everything is up to date." Finally, there's the clinic note. This is the detailed information written by the doctor or nurse during or after a patient's visit. It becomes a permanent part of the patient's record. You might see a notification that says, "The doctor entered a note in your chart." These notes are vital for tracking a patient's care journey. Mastering these office terms will make you an efficient and invaluable member of the healthcare team. Thank you so much for watching and learning with me today. We've covered some of the most common medical terms that help us all communicate better in a healthcare setting. From appointments and referrals to body systems and administrative tasks, each word plays a role in delivering effective care. Remember, learning this new language is a journey, not a race. It's all about helping us serve our veterans with the confidence, clarity, and respect they deserve. I know I'll be practicing and learning new things every single day, and I encourage you to do the same. Keep that curiosity alive. If you found this video helpful, please give it a thumbs up and consider subscribing for more content like this. It really helps the channel grow. Thanks again for your time, and I'll see you in the next video.